So I know that can be a really intimidating thing for a lot of guys. It sounds really creepy going to a clinic or a room to do your business. I'm Dr. Kelly Walker. I'm a reproductive urologist and medical director at Posterity Health.
My name is Joseph Alukal. I'm a urologist on faculty at Columbia University Irving Medical Center and New York Presbyterian.
Hi, I'm Dr. Barrett Cowan, a reproductive urologist from Posterity Health.
Most of the time, an evaluation starts with a semen analysis. So I know that can be a really intimidating thing for a lot of guys. It sounds really creepy going to a clinic or a room to do your business. But there are at-home kits available now that are legitimate. And so I really recommend speaking with your primary care doctor, your partner's OBGYN, or seeking out a reproductive urologist like myself. And we can get you all set up for the semen analysis.
Remember, when we check a semen analysis, there are three variables that we look at. The count, meaning how many sperm are present, the motility, which means how many sperm are actually swimming, and what we call the morphology, which means the size and shape of the sperm and how many of them look normal. So there can be issues with count, motility, or morphology, and many of those can be traced back to behavioral and lifestyle issues, underlying medical issues, and sometimes anatomic or genetic issues as well.
So if there is an abnormality, we have you see a reproductive urologist specialized in this space, do a complete history, physical exam, oftentimes additional diagnostic work like a hormonal blood panel to figure out that underlying cause or reason, and then we can treat it.
It's going to include a thorough history, so I need to ask the patient a lot of questions, need to find out about his medical history, his surgical history, medications he might be taking currently, supplements he might be taking currently, his family history. I need to find out about his partner. He needs to tell me how old the person he's trying to have children with, how old is that person, do they have any medical issues that they're aware of, have they been evaluated by a reproductive endocrinologist, and what did that physician find? I need to do a thorough physical exam of this patient. And so that includes everybody's favorite moment when they're seeing the urologist and they get asked to drop their pants, turn their head and cough. All of that fun stuff. I want people to be prepared for it though. It's just a few embarrassing moments, but it gives us an awful lot of information that we need.
Looking at their overall body habitus, or their size, their shape, their weight, their BMI is really important. Understanding what their thyroid gland feels like, whether they have any breast masses, and obviously feeling the size and shape and contours of the testicles. We also look for the presence of the vas deferens, whether a varicocele is present, and whether the epididymis, which is the accessory gland coming off the top and back of the testicle, whether that's been formed properly or not.
Oftentimes additional diagnostic work like a hormonal blood panel to figure out that underlying cause or reason.
There may be some other testing that gets done depending upon what data I'm looking at already. That could include things such as a Doppler ultrasound of the scrotum, so an ultrasound evaluation of the testicles and the surrounding structures. It could include some genetic testing, oftentimes drawn via more blood work. It could include more sperm testing, including things like a DNA fragmentation assay of the sperm.
I think the most important thing is just come on in and relax, and remembering that this is not an issue of your masculinity or virility. It's a health issue, and let us help you.